Mr. Tennies. My name is Melissa. I'm going to be your nurse practitioner today, and today we're going to be doing an exam. It's going to cover a whole lot of different areas of your body. I'm going to be checking strength. I'm also going to be feeling different parts of your body. Are you okay if we do that?
Yes.
Okay, and you're okay if I touch you?
Yes.
Okay, perfect. So the first thing that we're going to do is I'm going to check your hand grips. This is just going to check the strength of your hands. I'm going to give you my hands right here, and I just want you to squeeze as hard as you can. Perfect. Okay, hand grips or strength is equal bilaterally, 5 out of 5. The next thing I'm going to do is check passive range of motion. Passive range of motion is where I do most of the work for you, but you'll just still participate in it, okay? So I'm going to check the strengths of your biceps. So you look like you've got some decent sized biceps right there, so it looks like they probably work okay. What I'm going to do is have you make strengths like this, and I want you to pull back towards you as I'm pulling. Perfect. And now I want you to push towards me as I'm pushing. Great. Strength 5 out of 5 bilaterally. Now I'm going to check a passive range of motion on your shoulders. What I'm going to do is I'm going to take your arm and I'm going to raise it up above your head. And I'm going to raise it below. Okay, same thing on the other side. Raise your arm up and raise your arm down. Do you have any pain or discomfort while I'm doing that?
No.
Okay. So now what I'm going to do is I'm going to check your internal and external rotation. I'm going to bend your elbow in, and there you go. I'm going to bend it in and move it out. Okay. Same thing here, bend it in and move it out. Great. And now I'm going to do what's called abduction and adduction, which is where I'm going to take your arm straight up and straight out, and then also same thing, up, out, okay, up, down, up, out. Perfect. Any pain or discomfort while I'm doing that? Okay. Now what I'm going to do is I'm going to check your cerebellar coordination with rapid movements. So you're going to put your hands up like this, and you're going to take your fingers and you go 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, just like that. Perfect. Now what you're going to do is you're going to take your hands and you're going to put them in front of you, and what I'd like for you to do is just put them flat. You're going to just rotate in and out like this. Okay. Any pain or discomfort while we're doing that?
No.
Great. So now what I'm going to have you do, you are normal and well coordinated in that area. So next what I'm going to do is I'm going to check what's called deep tissue or deep tendon reflexes, and I'm going to use, you've probably seen one of these little hammer looking things before, and I'm going to check your biceps, okay? So what I'm going to do is put my hand right here, just stabilize your arm. I'm going to put my thumb right here, and I'm just going to tap. Okay, same thing over here. Okay, perfect. I saw a little bit of a jerk right there, so it's good contraction there. Now I'm going to check your patellar reflex. So what I need to do is actually move this down just a little bit. Here we go. Okay, and what I'm going to do is look for the little notch right here, and I'm just going to have you relax your legs just a little bit if you can. Scoot back a little bit, yeah. Okay, and then I'm just going to tap. Okay, and then tap right here. Perfect. You see a little bit of a jerk right there. So now I'm going to check your Achilles. What I'd like for you to do, are you able to take your shoes off? Is that okay?
Not very easily.
Okay. Well, I'll just... Sorry. All right. So now that we have high top sneakers off, I'm going to be checking your Achilles, and what I'm going to do is I'm going to dorsiflex your foot and tap with the hammer. So what I would like to do is right here.
Camera can't see.
Okay. Okay. Go ahead and dorsiflex right here. Okay, perfect. All right, so now I'm going to, you have pronation there. So now what I'm going to do is do an abdominal exam. If I can have you actually lay with your head this way. Thank you. I know it's a little bit opposite. So what I'm going to do is I'm going to do what's called auscultating your bowel sounds. So with doing that, what I'm going to do is just listen to your stomach. Are you okay if I touch your stomach for just a minute? Okay, so what I'm going to do is I'm going to start in the lower right quadrant. Okay, and then upper right quadrant. Okay, upper left quadrant. Lower left quadrant. And normally I would listen for 1 full minute in each quadrant. However, I'm not going to do that today. Okay, and I heard bowel sounds in all 4 quadrants, which is great. Now what I'm going to do is I'm going to auscultate your aortic, which is going to be midline lower xiphoid, and I'm going to use the bell here. And no bruits are present. The next thing I'm going to do is I'm going to listen to your left renal, which is above and lateral to your umbilicus. Okay, no bruits are present. Next thing I'm going to do is listen to your iliac. Your iliac is below your umbilicus. No bruits are present. And bowel sounds present, all 4 quadrants. Next thing I'm going to do is I'm going to percuss all 4 quadrants of your stomach. So the same thing like what we were doing, listening to them. And what I'm going to do is I'm going to be checking for tympany, dullness, and flatness. Okay, I'm just going to put my fingers here and I'm just going to tap against my fingers, okay? Okay. That sounds clear. No dullness, no tympany, and no flatness. Next thing I'm going to do is palpate all 4 of your quadrants for tenderness or masses. And what I'm doing with that is I'm just going to be touching all 4 quadrants. You okay if I do that?
Mm-hmm.
Tenderness, anything like that?
No.
Any tenderness?
No.
Okay. Okay, no tenderness, no masses noted. So the exam is normal. Next thing I'm going to do is I'm going to palpate your liver. So what I'm going to do is I'm going to have you turn, or actually I'm just going to put my left hand underneath you, and then I'm just going to put my right hand on top to palpate. So I'm trying to get into the camera view here. Okay. Any pain or tenderness?
No.
Okay, perfect. The next thing I'm going to do is I'm going to check your spleen. So what I would like for you to do is roll over towards me. And with checking your spleen, I'm going to push on the costovertebral angle, and then I'm going to have you take a deep breath, okay? Okay, go ahead and take a deep breath for me. Okay, perfect. No pain or tenderness when I do that?
No.
All right. So now what I'm going to do is check your range of motion on your lower extremities. First, what I'm going to do is I'm going to check the flexion of your leg. I'm going to have you go ahead and turn over to the other side now, so that way we can get like your head up here. Okay, so what I'm going to do first is I'm going to do what's called abducting and adducting. I'm just going to take your leg, go ahead and relax it. Okay, perfect. Any pain or tenderness?
No.
Okay. Next thing I'm going to do is I'm going to do an internal and external rotation. So what I would like for you to do is bend your knee for me. And I'm just going to do an internal rotation, external rotation. Any pain or discomfort while I'm doing that?
No.
Okay, great.
One
Okay. And now what I'm going to do is we're going to extend and flex your knee. So go ahead and put your leg up, and we're going to flex and extend. Pain or discomfort?
No.
Okay, great. Go ahead and relax your leg. Next thing we're going to do is bend your knees. I'm going to have you pull and push against resistance. So go ahead and bend your knees for me, both of them. Okay. And I'm going to have you lift your legs up a little bit Okay, perfect. And I want you to push against my hands. Great. And push against my hands. Perfect. Okay, 5 out of strength bilaterally on both of his legs. So now I'm going to do a passive range of motion on your ankle. So what I'm going to do is we're going to do a dorsal flex, plantar flex, and rotation. So with your ankle, I'm going to have you go up, go down, and do a rotation. Okay, great. And is this your bad ankle? Okay. He broke his foot recently, so it's a little bit difficult for him. So let's do it on your left or on your other leg. Okay, up, down, round, and round. Okay. So I hear some cracking, but no pain or discomfort on that foot. Okay, perfect. So 5 out of strength bilaterally. Now what I'm going to do is I would like for you to push against my hands. Okay, push against my hands. Perfect. 5 out of 5 strength bilaterally. Next thing we're going to do is I'm going to have you stand up, and we're going to do range of motion of your spine. So with this, what I would like for you to do is I would just want you to be careful of your head, maybe turn sideways. I'm going to have you reach down and touch your toes for me. Okay. Next thing we're going to do is extension. So what I would like for you to do is just lean back as far as you can, comfortably. Okay, perfect. Next thing I want you to do is we're going to check what's called a lateral flexion. I want you to lean side to side for me like this. Okay, pain or discomfort there? Great. Now we're going to do rotation. So what I see you usually do around the house, I'm going to have you just flex like this and rotate. Perfect. Pain or discomfort there?
No.
All right, great. So now what I'm going to do is, it's called a Romberg sign. What I want you to do, it's kind of like closing your eyes and just standing very still, okay? So I'm going to put my hands on either side of you just to keep you safe. And I want you to take your hands out of your pockets, close your eyes, and just stand still for 20 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Perfect. Okay. Thank you for your time. Do you have any questions before we finish?
No.
Okay, great.
Thank
Thank you.